between 5 and 15% of individuals have a sensory processing disorder, and we all have sensory profiles, and many of us also experience sensory processing differences and challenges that don't fill the diagnostic category of a disorder, and yet we have challenges and differences. 50% of ADHDers have sensory processing disorder and 75% of autistic folks. There's a high correlation between sensory processing disorder and anxiety disorder, given that sensory sensitivities put a child or an adult at risk of experiencing anxiety. And there's a high correlation between post-traumatic stress disorder and secondary sensory processing disorder, meaning that traumatic memories become encoded as sensory awarenesses that become embedded in implicit memory, like trauma-related hashtags or trauma-related cues. And so this is where I hold that space of I don't know with a client, and yet to be able to meet the client to facilitate sensory satiation and to prevent sensory overwhelm and burnout. Developing a working alliance. So we have challenges here. And this is for working with complex developmental trauma, specifically that when there's been a lot of interpersonal traumatization at the hands of caregivers. And so that's where we're working with competing needs, competing adaptations for survival. I want to flee, but I want to get close. I want to control you in order to take care of you. I want to control you so that I can punish you. And so we're actually holding space for long-standing feelings of mistrust and betrayal, where clients alternate, right, between parts or the adaptations within a part. Yeah, demanding and withdrawing, pleading for and rejecting, charming and defiance and ghosting, grandiosity and self-loathing, entitled rage and helpless rage. And this is where Janina Fisher's TIST model can be ever so helpful. And I want to share with you the work of the drama triangle with the neglectful bystander and the unresolved wounds of the inner child, where we can get caught up in a client's drama triangle inadvertently. It happens to all of us. It's okay. And yet there can be 4 main patterns that are identified, that Davies and Frawley identified, specifically working with survivors of CSA, which can replicate itself in our therapy relationship. The unseeing, uninvolved parent and the unseen, neglected child, the sadistic abuser and the helplessly, impotently enraged victim, right? This is the aftermath of what happens when we don't have a coherent sense of self. Yeah, and coherence is a phrase that's used in the attachment world, that when there's good enough attachment, we develop internal coherence. Yeah. And so in a way, all of this is actually phase 1 work, because we're navigating some pretty treacherous terrain. And so many of these self-regulation techniques are techniques that I use for myself when I'm with clients, so that I can be very conscientious about what and when and how, because we can only move as fast as the speed of trust.